Stroke is a medical emergency. It is basically an event in the brain where there is vessel which is occluded. Mainly the arteries are occluded, or the arteries can be ruptured because of the increased pressure. There are two types of stroke, ischemic and hemorrhagic stroke. Both of these types of stroke can occur because of multiple risk factors such as hypertension, diabetes, sedentary lifestyle, poor cholesterol control, and age, which is also another risk factor which cannot be modified. However, diabetes, hypertension, sedentary lifestyle, and cholesterol or dyslipidemia, which we call, can be modified. Unfortunately, in our society, this particular disease is not very well known. That is, awareness itself is very limited. This stroke day, which is on 29th of October, we would like to bring awareness about this disease, which can impact millions of people all around the world. Stroke is not usually recognized because there is no pain, which is usually seen in cardiac conditions. Many of the strokes get unrecognized. So important aspect is to first identify the signs. We have an acronym called BFAST. B stands for loss of balance. Letter E stands for loss of vision. F stands for facial drooping or deviation of angle of mouth. A stands for arm weakness. S stands for slurring of speech. And T, the most important of all the 6 letters I've mentioned, is the time. Time is very important because every minute counts in stroke. As there is lack of blood supply to the brain, as the artery is occluded, we need to act quickly so that the brain function can be restored. There are different ways to restore the brain function by mainly opening up the artery which is occluded. We can do 2 types of treatment. That is, one with giving an injection which opens up the blocked artery, and second one is by going into the artery through the groin artery and opening up the artery using a device called stent retriever. This particular procedure, in which an angiogram is done and an artery is opened with the help of devices, is called mechanical thrombectomy. Point to be noted, we need to act within a specific period of time after the onset of symptoms, that is 4.5 hours, which is very, very important. After the 4.5 hours, the brain function cannot be restored as the brain cells are already dead because of the lack of oxygen. So please visit a nearby stroke ready center whenever you notice these symptoms, that is BFAST: loss of balance, loss of vision, facial drooping, arm weakness, slurring of speech, and T being the most important, within 4.5 hours. After stroke has occurred, we have to continue the therapy. That is mainly in the form of taking medications so that we can prevent another attack. So what are the medications which are prescribed usually? We prescribe antiplatelet agents, which is nothing but blood thinners, so that further events do not occur. Along with the medications, we need to take care of controlling the sugars, controlling the BP, leading a healthy lifestyle, and also controlling the cholesterol. These are the medication aspect. Along with this, we need to do regular physiotherapy, which needs to be done on a regular basis till good amount of functional outcome has been achieved. One more aspect would be to prevent another event. We not only look at these medications and physiotherapy, we also can open up an artery which is going to get closed. For example, if there is an artery in the neck which is leading up to the brain, which is almost 99% occluded, chances are that it can get occluded 100%. Meningitis, which can lead to another event. So in that case, we need to open up the artery so that another event can be prevented. This artery can be opened up using two ways. One would be to place a stent in the occluded, in the stenotic or in the blocked segment. Another one would be to open up the artery by going through surgery. Using a stent, the procedure is called carotid stenting or stenting of the intracranial arteries. Another method which I mentioned was through the surgery, which is called carotid endarterectomy. Both of these can be performed so that we can prevent further events. Stroke is not just a disease which has to be taken care only when the patient is in the hospital. It has to be taken care even after the patient has been discharged from the hospital to make sure we prevent further events. Thank you.